Now, as far as what a general family's practice physician or family doctor will be making at 26 years of age after college for the first year of income. Realize a doctor can only log into an A-Service system for wages only if they have clientele to serve or to act on for help for the future. All doctors will set up their appointments in either 15-minute sessions, 30-minute sessions, or 1 hour session appointment slots to deal with the patients. And if they have less than 2 hours a day in appointments, that doctor or facility will only be able to stay available to the public's eye for 7 years if doctors' offices can't maintain 33% clientele on average. What I suggest is there to be 2 6-hour shifts open for each doctor's office to see clientele. That could be 1 or more doctors in the morning to handle the patient's needs and have a second shift to cover appointments in the afternoon. Now the doctors will no longer have to work 12-hour days. If the clientele where it's causing the doctor to work extra 3 hours a day in overtime, I suggest that clinic adds another doctor to the facility to handle the clientele. There should be no doctor working past 10 hours in any given day. If so, the A-Services will contact that office and tell them they need to get another doctor to fulfill the commitment properly for the people to be addressed by a doctor that's not rested accordingly because of putting in long hours of being strung out by too much on the doctor's plate where there could be mistakes made. A starting doctor without kids living in a population of 150 to 200,000 people, we will say that the cost of living would be $2,600 a month or $33,800 a year, and their establishment is a Tier 3 facility. The amount would be $183,800 for total income, $33,800 for cost of living, and $150,000 a year starting as a doctor only working 1,500 hours for the year, making $100 an hour. Now we will see what the first year doctor with no kids at a Tier 1 facility receiving $33,800 a year for cost of living will make. The doctor at Tier 1 will be making, for 1,500 hours of work with the cost of living figured in, $213,800 for the first year. The wages equal $180,000 alone, which makes an extra $30,000 more than a Tier 3, and Tier 2 facility will be making an extra $15,000 a year starting as a doctor. And for Tier 1 doctor, we'll be making $120 an hour versus $100 an hour at a Tier 3 standing. Now we will look at the 13th year of work at the age of 38. Being a Tier 3 facility, all the years worked receiving your first pension without kids, with getting paid $33,800 a year for cost of living, you would be making $127.71 an hour with an income of work committed for the year of 1,500 hours. This will equal $191,574. And with cost of living, $33,800 to equal $25,374. And your first pension starts, that will make you $30,279 a year for life. This leaves you a total income of $255,653 a year. Now we will say everything is the same except for a tier 1 facility where your total for the year would be $300,023. That's a difference of $44,370 from being in a tier 1 facility versus being in a tier 3 after your 13th year of work. You would make $6,055 more a year for a tier 1 pension at the age of 38 than being in a tier 3. I had thought that was quite a difference to be able to receive an extra 20%. But I think it's very serious for the medical attention to receive by medical providers out there in the world to be taken seriously and will be paid greatly for their excellence and commitment and service. Another example would be the age of 58. After 32 years of work, what you would be making after receiving both pensions and the cost of living of $33,800 a year working for a tier 3 establishment all your life. You will be making $192.01 an hour, 2 years short of making a max pay of $200 or $288.14 a year, 1,500 hours of work, cost of living $33,800 a year, and will equal $321,814. And then when you figure in both pensions, a total of $100,515 a year for life to bring your total income to $422,330 a year. This should be a bare minimum if worked 1,500 hours of work. Now we will say we're in a tier 1 facility all your life and your cost of living is $33,800 a year or the same. You will be making $500,036 in income a year or more if you choose to work past 57. That's 230.41 an hour working 1,500 hours a year will make you $345,617 in income, with the cost of living will equal $379,417, and with both pensions will equal $120,619, giving you a total of $500,036. Realize if you were in a tier 1 facility all your life versus being in a tier 3 facility, this will be a difference per year for your life that you will be losing $20,104 on your pension. So we know we all want to be part of a tier 1 establishment, but actions from the people will decide the fate of these medical establishments. You can see the difference in income as well from pension working with the pensions at a tier 3 versus a tier 1, showing a difference of $77,706 a year. If you work 7 more years and retired at the age of 65, you would receive $131,745 for retirement from both pensions combined. We will use the same cost of living of $33,800 a year to give you a grand total of $165,545 a year working for a tier 3 facility all your life, or from working from a tier 1 facility all your life. Life will grant you $191,894 a year, or $3,040 a week for life. That's to also include in the figure of $33,800 for the cost of living. So you can kind of see that being a tier 1 makes an extra $26,349 a year after working a lifetime in a tier 1 facility for retirement. If a tier 2 will make an extra $13,174 a year for retirement at 65 if you were working as a tier 2 facility all your life. If you want to figure in what an individual will get if they had kids, well, only one kid can give you credit through the government of $500 a month or $6,500 a year. Let's say a couple has 3 kids, or each partner in the relationship can claim 1 child from the government. And as long as the child is in the care of the one that claims the dependent, they will be able to collect on the child until the child turns 18 years old. If your first child fell off the child credit due to turning 18, it will automatically place your other child on the list because they will be registered in the system. If they are not already receiving child credit to a parent from the government, nothing can be removed from the medical records of the individual from the hub at the doctor's location or any other location. Only the ACE Services ACE of Hearts department can add or change a file only if there is discrepancies that are incorrect in the file. Elsewise, everything annotated in your medical record will be permanent as time goes along for each person. Numbers 2501 to 7500 will be any common medical supply list used to treat the people, to where any medical worker will have the access to order up anything on the list to have on hand at a facility. As items on a patient are prescribed or used, where it will be annotated in the records. The ACE Services system will automatically order and replace whatever they list for said patient to restock the facility or to be ordered to the patient's living location. Numbers 7501 to 10,000 are equally divided into 5 different categories of types of surgeries. For instance, numbers 7501 to 8,000 may cover any procedures or surgeries to do with arteries, the heart, and 8,001 to 8,500 may cover anything to do with the activity of the brain or related surgeries. 8,501 to 9,000, these numbers may cover joint replacement surgeries. Dental, vision, and hearing will have different lists in the ACE service system to choose from of items which would be for the people, such as prescription eyewear, contacts, hearing aids, retainers, anything to do with in helping the people. From the last 5 years going back, the time I would take office adjusting it to America's living and work standards for the world to enjoy is how it will be established as a common average to figure out the economy will be adjusted to. No patient will have to pay for surgeries, medical or hospital visits, nor will they have to pay for office calls at the doctor's office. Your records will be stored in the ACE Services database, and all people will have the ability to keep an organized record of practice performed when they can view their records at any time through the phone or computer, and it will be secured only to the individual's access. Once the procedures performed by the doctors are entered into the database of the exam or whatever tests that were ordered up of the individual, will then go to the ACE of Hearts site district. It will be like a domino effect where your itemized list will order up all new supplies and pay for everything along the way for each list as they are to be used. So if it's allotted, will pay everyone that's involved doing the functions or the tests that are to be selected of an itemized number list provided on the site for the doctor. It then will automatically forward to the Ace of Diamonds office to pay out the doctor or the services on each individual or anything within the medical field at the end of the week or 2 hours after 12 every Sunday morning throughout every year. Because of each itemized number, which is used to correlate the payout for the needs within the medical field for everything to flow accordingly. All medical practices will be paid for by the government. You will no longer need to purchase medical health insurance, but there will be outside sources in the medical field that may perform medical services that the government doesn't cover. Examples are such as breast enlargement surgeries, tummy tucks, sex changes, Botox, anything that is not considered life-threatening like cosmetic surgery. Other examples like nose jobs, cheeks, chin, alters one's appearance will not be covered by the government. You will have to pay for an outside source to perform these types of surgeries, and there may be insurances offered to cover these surgeries and procedures performed by outside doctors. The people will not have to pay for regular care. Walter Davis. I like what I hear. That seems to be really good policy for the people. What about medicine, prescription drugs? How would that work? There will not be outrageous prices for prescription drugs. The government will monitor and will ensure that there will be fair prices for all prescription drugs or medicine to be used in treating such patients. You see, these pharmaceutical companies that make the medicine are going to be regulated by the government in order to function as a pharmaceutical company, not as a company that feels they can charge whatever rate they think they can make money off of, like Pfizer, BioNTech, Johnson & Johnson, Moderna did, like charging an outrageous rate for a vaccine that was less than 33% effective and charged $1,800 per vaccine. Not only did they make a vaccine that wasn't effective, that made 3 more series of the shot and boosters that I consider not effective, that was administered to the people. An article I had looked up said that Pfizer, BioNTech, and Moderna are making $65,000 a minute for the vaccine. That's over $34 billion a year, and it's been going on for more than 3 years. The people are still getting COVID-19. I'm sure these companies probably made trillions off of the governments around the world. I believe there are side effects that the public is getting now from receiving the vaccine. Now the people that had received the shots are going through severe symptoms of the shot. You realize plagues and diseases happen every so many years to thin out the population to make us a stronger race here on Earth. You can't make miracle cure overnight without having repercussions. Just like with insulin for diabetics, they are selling that 5 injective insulin pens for $1,100 a month to supply, and charging these outrageous prices for medicine to the insurance companies and the individuals that have diabetes, which probably costs less than $10 to produce. Another medicine is for male erectile dysfunction, where it's Viagra that charges $25 a pill that lasts less than an hour when used. There are other medicines to use like Viagra out there on the market, for instance, Hims, that charge a couple dollars for the pill, which is cheaper. This makes me wonder how pharmaceutical companies are not regulated. In the new world, all pharmaceutical companies will be regulated. All medicines will have to show an improvement or an increasement of bettering the condition at hand from the medicine to show an improvement through the proven results. You hear all the time on some of the medicine out there on the market stating that whichever medicine may inflict bodily harm to you or even death. Now, why should anybody take a medicine that can cause harm, which is not safe, is not a safe medicine to take? I know of 2 medicines that I was put on that will be removed for the use that it was intended for. One of them is lithium, where it will mess up your nervous system, and it messed up my thyroid in my body after taking it. Another medicine to try and control manic outbreaks is olanzapine, where it did not control the manic episodes that I had, caused me great difficulty and dizziness, and I gained over 40 pounds in less than 30 days being on the drug. Drugs like these are going to be withdrawn from the market of sale and banned for the people's use. There will be a couple ways to prove the worthiness of the medicine. One, there will have to be a panel of 100 random people to test out the drug or any drug, vitamin, or vaccine that will be monitored, that will monitor all body functions of the 100 while taking the medicine. Lab work has to be drawn every 3rd day to monitor the chemical reaction it has on the body, and it shall be administered for 90 days to show the outcome of the 100 patients. They are to be observed by a pharmaceutical company that is offering their new breakthrough. All medicine, vaccine, and vitamins will have to be given the right to sell and market within the government, as each medicine will be observed through the testing to make sure they are safe for the people. Then it will have the availability to be on the market to be used by the people through the government. I'm estimating that there will probably be 50% of the drugs that are on the market be denied their rights to allow them access to be allowed to use for the people, and will be removed for the protection of the people. Anyway, a pharmaceutical company will have to show proven results of each different medicine that they say can improve one's health in order to get paid for said medicine. It has to show at least 10% improvement to one's condition or health that it is administered through. The random 100 participants of the said vitamin, drug, vaccine that would be allowed on the market. There will be a standard questions that the 100 participants will have to take after the 90 days they had been administered the medicine. A services biological medical assessor will verify each medicine to be adequately performed through testing. Also, they will verify the results in testing along with the costs to make the said medicine, for prices can be adjusted and accepted as for fair for each medicine. On the standardized test, where the answers at hand of all that are to be tested for the effects of your body or differences in your health, that is noted to respond to according in good results from all the tests performed. As far as written questions, there will be an area that will give an assessor of A services the capability of evaluating each question on a scale from 1 to 5 to see how effective the response to the medicine is. If the question averages out with a 4-star, it will count for the percentage of goodness across the 100 participants when dividing out to grant 10% or more for the positive turnout of the medicine. Between the lab tests that are done and the close evaluation of each of the 100 shall have any serious problems with the drug or even death, it will not be allowed for the people. When the tests come in and they can prove results in the patient to be above 10% increased condition or of being complete fix remedy of whatever sickness, disease, or system of problem, they will be able to charge 100% of what the cost of making the medicine, vitamins, or vaccine. If the medicine is a complete fix to the person's condition or daily need to regulate a person's condition or in a pharmaceutical condition, the pharmaceutical company will be able to charge up to 200% of the cost to make whatever medicine. Only medicines that are more than 10% effective or better will be authorized to consumption to the public. But there will be effectiveness on percentages addressed from the testing on each medicine showing how effective it is. So if it was chickenpox shot or a vaccine, it will say 100% effective for the vaccine. If it's a flu shot, it may say 30% effective. The results to testing will show the percentage to be paid for each medicine. For instance, for this example, Viagra, known it is a working drug for the middle-aged male crowd of the world. Viagra will get 100% for a successful drug, and let's say 90% for correcting the problem from a study of 100 people to be awarded. If it was not 100% effective in all testing patients, it will be able to show. If it was not 100% effective in the test patients, it won't be able to show 100% for the medicine or get up to another 100% paid on such medicine. This will be the standard for all basic medicine and vaccines out there in the market. But when you look at the rarity of a disease and cases of illnesses that are not common, if the disease or sickness is less than 5% of the population, the pharmaceutical company will be able to charge up to 500% on top of marketing the vaccine or the medicine to the government for a total of 600%. If it's less than 1% of the population for a disease or sickness, the medicine antidote for the sickness or disease from the pharmaceutical company can charge up to 1,100% to the government for providing the serum or whatever medicine for said sickness. For instance, vitamins will be tested for effectiveness, for they will be able to sell for 100% over the cost to make, but the vitamin isn't curing anything, just to keep healthy, and effectiveness of this vitamin will be based off the increased levels within the blood work to show the percentage of effectiveness. I looked up and see there are over 20,000 pharmaceutical companies in the world currently. After the New World Order goes into effect, there will only be 10,000 facilities that the government will pay to. The 10,000 facilities in the world will get the same replacement cost of their properties as the medical facilities receive, and that's 0.0666666 to the 10th decimal place. This number is used in calculating what will be paid to each facility of their assessed property value that is addressed to each facility. This will happen for all the pharmaceutical companies that the government sponsored separately to get paid out monthly or yearly. The rate of assessed value is meant to replace the costs of the facility every 15 years. These businesses will have to pay for whatever is needed for the lab, like technical equipment. Each year, different biological labs that are not sponsored by the government may take the existing pharmaceutical company from the bottom of the list if they are showing breakthroughs in different medicines or solutions for the people of the government. Also, of animal advancements in medicine and breakthroughs, and will have some facilities to cover chemical engineering for the environment to come up with biofuels and agents to be invented through these labs that the government will sponsor. The list of companies will be listed from the most breakthroughs of authorized medicine, vaccines, vitamins, of the advancement in chemicals through proven results will be authorized for the people in the new system. This way, only legit medicines and advancements will count for each pharmaceutical agency or chemical agency. All medicine of credibility will be paid out accordingly through ACE services. A biologicus or a chemical biologicus will be paid $30 an hour to start, $45,000 a year for 1,500 hours of work, and there will be 20,000 employed by the government only to support these facilities or biolabs around the world. All other staffing of these facilities and maintenances, remodeling, or updates to the facilities will be provided by the sponsored chemical company. The new testing will consist of 100 people test results of whatever is to be considered as worthy as a medicine administered to the people. The ages for testing most drugs and different chemicals to be used for the people will be from 25 to 65 years of age, and for children and infants will also be another category. If the biochemical company develops a new product on the market, they will hold the rights in the patent office within the United States, owning the rights to the new product or invention for 20 years before any outside parties can open up to the market. This will include whatever medicine newly developed, produced, or function. In the ACE service system, for doctors to look up the selection of medicines to be able to select from a given set list to use whatever drug in the world through the system for the patients. So as the doctors write in the condition into the computer, it will show a list of medicines in the computer of ACE services to be used by all doctors. This will list all the medicines for that condition. It is recommended to use the first medicine from the list due to the fact it is the best review results in testing. So if there's 10 medicines from a list we'll use, for an example, to get rid of a headache, all 10 will work, but the one on top of the list will be selected most likely. It can also be of preference to what the patient would like. If there isn't much difference in the quality of medicine, the cheaper medicine will be placed higher on the list that is suggested for the remedy. Understand, you will not see the charged amount for each medicine, vaccine, or vitamins. Only in the ACE services office will show data of this sort to be used to pay the appropriate agencies. Everything will be paid for just as the medical is annotated in the records of said patient. Understand that pharmaceutical company can reproduce any product that has expired its 20-year granted probationary period for creating something new, and all will have the ability to abide to make up to 200% on the cost of making a basic medicine on the market. But understand, the cheaper medicine in the system of the same percentage of effectiveness will be used, most likely, unless they have a worthy name for the medicine that the doctor or patient knows as considered to be worthy. Over-the-counter drugs such as cough medicine, flu, aspirin, things of this nature will be accessible through the stores for the people to buy, and the government may or may not pay for these items for you. You see, everyone will have the ability to go to the doctor's facility or medical facility that handles appointments where they can authorize $200 credit to you every 6 months to purchase over-the-counter medicine supplies and medicine, which comes from the government to go into your account only for the use of purchase of medical supplies, over-the-counter medicine of your liking that will be given to all people from your files. You will only get 200 of the credit at a time every 6 months. You must be 18 years of age to receive this benefit, and all over-the-counter medicine supplies and medicines will automatically known while trying to purchase whatever medical supplies in the stores of the world or the market, or of the market if it is authorized by the government for purchase of said credit given. Walter Davis. That's good. That's all good. I like to hear that. What about the elderly who have got to go to care facilities? What would be the plan on this? Well, care facilities will be monitored and paid for just as the medical facilities and hospitals to figure out. The nursing facility will get paid 0.0666 to the 10th decimal place to the assessed property that will be paid out monthly or yearly. If the patient is to be in a care facility, they will no longer receive cost of living allowance, but the government would allow them a small supplement of money to ensure that they have items such as clothes. There may be extra money allotted for entertainment granted to care facilities for special functions and activities. There will be a secondary ACE service office. Caregivers in each community or acting caregivers that are in each community will have to adopt to the ACE service policies and procedures. They would have to abide by and perform the needs for the community. This will also come from the Ace of Hearts office for assistance of patients that need such care. It will be paid out by the Ace of Diamonds office of each district, said facility, and all people involved in their duties of care facility authorized and decided by the government standards.